Hey everyone, I'm Lucy Douglas. I'm a family nurse practitioner and I'm owner and CEO of New Beginnings Wellness Center and Spa in Ruston, Louisiana. I just wanted to talk for a little bit this evening about how I work with young people, with children. I don't know that that's widely known. I'm not a pediatrician, obviously, but I view myself as a support person. I view myself as part of a team if a child is having some difficulty in an area. And so often parents will reach out and they will want some advice, and generally in the nutrition realm, about how they can help their child overcome whatever issue that they're facing. So some of the things that I've helped parents with, I've mentioned previously, attention deficit. I've worked with quite a few moms in helping them bring diet in line to optimize their children's performance and health. Certainly that is one tool in our toolkit. Sometimes these children are on prescription medication for ADD. Sometimes the parents have opted not to go that route and are looking for a more holistic approach, including supplementation, behavior modification, nutrition, all of those things to help their child reach their full potential. I've worked with children with autoimmune disease. I've worked with a couple of moms that had children who were on the autism spectrum. So it's just something I wanted to mention to let you know that if your child is struggling in an area, that I might be someone that could be a support person to you to do labs on your child that are a bit more in depth than what I've seen when parents have brought labs to me from other places, to give you a look into your child's nutritional status. What are their nutrient levels? How is their thyroid performing? I have more extensive testing that can be done. So, and then we take all that information in light of what the child's issues are and then discuss nutritional strategies, supplement strategies, behavioral strategies to help the family help that child reach their goals. So that's something that I feel very strongly about. I love working with children. I love working with families who are all in it together for the benefit of the child. Some of my favorite testimonies have been when moms bring kids, generally, a few times dads come, depending on their work schedule. But I love it when everybody's like leaning in and even the child's asking questions and everyone's very open to my perhaps recommending that we remove certain foods for a period of time. And, that can be challenging, especially when you're, the two autistic children that I met and counseled with their moms. Both of those children were profoundly developmentally delayed. There were some of the classic autism symptoms. And moms were both really struggling with helping their children with proper nutrition. So I was able to give those moms some tips to try. One mom, the child, a lot of these children have significant texture issues, so introducing new foods can be an enormous challenge. But I was able to give the mom a smoothie recipe, and I said, don't let him see you make it. Because the smoothie recipe consisted of a plant-based chocolate protein powder, and then a plant milk, and then some kind of frozen fruit, but spinach and avocado. And so when that's all blended together, you cannot taste the spinach or the avocado, but it gives the shake this really neat green color. I said, don't let him see you make it, but then tell him it's his Hulk shake. So I was able to follow up with that mom after we tried that. So this was a way to get some really dense, good nutrition into this little boy and try to get around the texture issue, though I'm sure he was probably still eating some of the types of foods he was most comfortable with, but at least we were able to get some fruits and vegetables in him. So I've really thought that was an awesome praise report when mom reported back to me that had worked. I've been able to work with a little boy that was on the spectrum, but not profoundly delayed, was doing awesome. And Mom brought him to me, had just this weird, not a horrific rash on the face. She'd been kind of concerned about it. And I examined him, and I turned to look at her, and I said, "You're not going to like what I have to say." And she was like, "What?" I said, "He needs to be off gluten and dairy." And she's kind of said, "Oh, I really thought you were going to say that." This mom was already doing so many great things at home for him. She already had him on some vitamins and, was cooking fresh meals and was doing a lot of great things, but she just needed a little bit more information. He was also had been struggling with some chronic sinus and upper respiratory problems, which can often be linked to food intolerances. And so we were able to kind of dig down and get at where some of that was coming from. And I was so amazed when she came back and brought him back for the follow-up that in those 4 weeks, he had been very cooperative with the changes that I had suggested, and they had gone to a birthday party. And he said, "Mom, can I have a piece of pizza?" And she said, "Oh, sure, honey, go have a piece of pizza." So I think that night at the birthday party, he ate a piece of pizza and a cupcake. And so he came to her, I think she said the next day, and this 10-year-old at the time said, "Mom, I cannot eat that." So he at 10 recognized that he felt very different from not eating gluten and dairy for a period of several weeks to then having it introduced back in that kind of a big dose, and noticed he felt different. So those stories to me are so encouraging because it validates my perspective and my approach that I know that nutrition is everything to us, and that foods send chemical messages to our cells. And so we want to be sending messages of growth and repair, not messages of death and destruction to the cell. And that even young children, if they're given that support and kind of taught at their level, they can participate in the process. And it's just so exciting for me to be able to partner with parents in helping their children reach their full potential. So that was something I just really wanted to take a few minutes to remind you that I do, and that I just view myself as a support person. And I want to give you additional information that oftentimes is not offered in a traditional medical setting, even in a specialty setting. And I just feel like sometimes when parents are in the throes of a problem with their child, they don't know that something like this exists, and that there's a person like me who will help you and dig a little deeper beneath the surface to try to uncover a root cause of what is getting at your child. ADD is so common in children, and I've talked at length about this with you before, but just reiterating to you that nutrition, when a child is struggling with a neurological issue, is everything to their treatment plan. It doesn't necessarily, in every case, take the place of prescription medication. And as I had mentioned to you in my own journey with my own child, we did pursue prescription medication to help our daughter. But one thing that was frustrating to me in knowing what I know now is that I didn't have all of this information, 25, 26 years ago when my husband and I were dealing with that issue with our child. So I just want you to know that there's more that you can know. There are often solutions that are outside of prescription medication, or there are nutritional and supplemental solutions that complement a prescription regimen. So it's not necessarily an either or. Every family brings their own unique perspective and value to the conversation that we have when we're discussing a problem with their child. And so I always want to work with what those parents are comfortable with and what their unique values are. And so please know that there is help that so many things can be overcome with changes to nutrition, to healing a gut, to optimizing nutrient levels, to optimizing a sleep regimen, and that I would love to be a partner and a support to you if you find yourself in a situation regarding one of your children. So thank you so much, and I look forward to visiting with you again soon.